Hello, my name is Amanda Baumgartner-Henley and I'm the Chief Nurse at the International Committee of the Red Cross here in Geneva. Just as in Florence Nightingale's time, many of today's nurses remain on the front lines in situations of conflict and violence where they attempt to ensure access to quality life-saving healthcare. Nurses in these contexts bear witness to the current massive inequality and lack of quality healthcare provision in many parts of the world. The suffering of millions of people with no access to even very basic life-saving healthcare is very real. In the International Committee of the Red Cross, we have the privilege to work in multinational, multicultural nursing teams where the professional and ethical ties binding us are so remarkably strong that even in the most challenging times, it is possible to deliver timely quality care to the most vulnerable. I recently heard the moving experience of a Danish nurse who was deployed by the ICRC to care for victims of conflict. She told me of an encounter with 4 local paediatric nurses who are single-handedly maintaining the 24-hour, 7-day-a-week access to quality nursing care in the neonatal unit. They have been doing this between them for 4 years already, with no sign of things improving anytime soon. My colleague was so impressed and humbled by their commitment to maintaining this vital access for vulnerable neonates in such difficult circumstances. The triple whammy of living in poverty in a natural disaster-prone country with an ongoing conflict or endemic violence is all too real for millions of people. It also is imperative that all those who seek access to healthcare, as well as those delivering it, are safe to do so, that health facilities remain a safe haven for all. I firmly believe that with the universality of nurses, we are extremely well placed to advocate for universal health coverage and access to quality healthcare. The commitment that motivates us to be nurses in the first place should also drive us to work towards equitable access to quality healthcare in peacetime and in war, in all contexts. No matter the location, no matter the setting, healthcare should be accessible for all.